This is the 6th annual Toronto 3D TEE perioperative echocardiography course. This is the tricuspid valve anatomy as presented on the GE Vivid E95 platform. With regards to disclosures and conflicts of interest, I have none. There are two essential windows for imaging the tricuspid valve by TEE. The first view is the RV inflow-outflow view. Here in this image you can see that the anterior leaflet in the RV inflow-outflow view is close to the aortic valve, which is presented medially, and laterally is the posterior leaflet of the tricuspid valve. The second important window to identify the anatomy and the pathology of the tricuspid valve is the transgastric short axis view of the tricuspid valve. Here in this view you can identify the anterior leaflet, the posterior leaflet, as well as the septal leaflet. You can also identify the coaptation plane between all three leaflets. It is common as an intra-procedural echocardiographer to watch the operators place clips between the anterior and septal leaflets, as well as between the posterior and septal leaflets along the coaptation plane. Schema of the tricuspid valve in the short axis transgastric view, and note that the relationship of the tricuspid valve to the aortic valve is that the aortic valve is in the 5 o'clock position in this view. Here you can also see the relationship of the anterior leaflet to the septal leaflet, as well as the posterior leaflet to the septal leaflet. You can also identify the number of leaflets of the tricuspid valve. This is an example of the short axis view of the tricuspid valve. Here you can see the septal leaflet, the anterior leaflet, and the posterior leaflet, as well as the coaptation zone between all three leaflets. It's a great view by which you can identify the location of a tricuspid regurgitant jet. The European and the American Society of Echocardiography recommendations for the 3D imaging of the tricuspid valve recommends that the tricuspid valve is always imaged with the septal leaflet at the 6 o'clock position, whether it is viewed from the right atrium or from the right ventricle. And in this view, the tricuspid valve looks like a frown. Despite the international guidelines on the imaging of the tricuspid valve in 3D, many interventional echocardiographers present the tricuspid valve in the on-fast view, mimicking the short axis transgastric view, with the aorta and the aortic valve at the 5 o'clock position. This is the example of the transgastric short axis view with the tricuspid valve presented in the on-fast view. Here you can see the relationship of the three leaflets of the tricuspid valve, the septal, anterior, and posterior leaflet, relative to the aortic valve, and the aortic valve being at the 5 o'clock position. This is a great view again to identify the location of regurgitant jets. The short axis on-fast view of the tricuspid valve is also a good view to identify the number of tricuspid valve leaflets. Sometimes there are 2 anterior leaflets, or 2 posterior leaflets, or 2 septal leaflets. As an imager or an intraprocedural echocardiographer, it's often good to come to a consensus with the operators as to how you will name and identify these leaflets. Of the tricuspid valve pathology, you can use the short axis view to identify the number of tricuspid valve leaflets, the location of regurgitant jets, the number of regurgitant jets. You can also infer the size of the regurgitant jets, as well as get some sense of the mechanism of the regurgitation. Sometimes you'll see pacemaker wires or leads in relationship to the regurgitant jet and the leaflets, and that may help you begin to formulate a hypothesis as to the mechanism of the regurgitation. You are now familiar with the anatomy of the short axis view of the tricuspid valve. Again, the septal leaflet is medial, the anterior leaflet is anterior, and the posterior leaflet is posterior. And you know that the aortic valve is at the 5 o'clock position. You can use your understanding of the short axis view to understand the RV inflow-outflow view. You can use the transgastric short axis view of the tricuspid valve to understand the RV inflow-outflow view by rotating the image so that the aortic valve is on your right. This reorientation roughly corresponds to the relationship of the tricuspid valve leaflets to the aortic valve in the RV inflow-outflow view. Here you can see that the tricuspid leaflets that are closest to the aortic valve is the anterior leaflet. Likewise, the leaflet that is furthest away from the aortic valve is the posterior leaflet. To further our understanding, let's tilt the plane of the tricuspid valve so that it is in keeping with the plane of the tricuspid valve in the RV inflow-outflow view. Let's also imagine that this is now a TEE ultrasound sector and place a multi-D cursor through the anterior tricuspid valve leaflet. You can see that this cursor will cut through the septal leaflet in the orthogonal view. Now that we understand the relationship of the anterior leaflet to the septal leaflet in the RV inflow-outflow view, we can represent it in the orthogonal view using the multi-D feature of the GE Vivid E95 platform by placing our cursor through the anterior leaflet. Here is the anterior leaflet in the RV inflow-outflow view, and you can see it in the orthogonal view on the right, and the septal leaflet relative to the anterior leaflet. This view is helpful to understand the coaptation zone between the anterior and septal leaflets, as well as identifying their relationship to each other, namely whether they are flail or prolapsing relative to each other. We can repeat the exercise again for the posterior leaflet of the tricuspid valve. Again, we can start with the short axis transgastric view of the tricuspid valve. The transgastric short axis view of the tricuspid valve to understand the RV inflow-outflow view by rotating the image so that the aortic valve is on your right. This orientation roughly corresponds to the relationship of the tricuspid valve leaflets to the aortic valve in the RV inflow-outflow view. Here you can see that the tricuspid leaflet that is furthest away from the aortic valve is the posterior leaflet. To further our understanding, let's tilt the plane of the tricuspid valve so that it is in keeping with the plane of the tricuspid valve in the RV inflow-outflow view. Let's also imagine that this is now a TEE ultrasound sector and place the multi-D cursor through the posterior leaflet. You can see that this cursor will cut through the posterior and the septal leaflets in the orthogonal view. Now that we understand the relationship of the posterior leaflet of the tricuspid valve to the septal leaflet in the RV inflow view, we can represent it in the orthogonal view using the multi-D feature on the GE Vivid E95 platform. Here you can see the posterior leaflet on the RV inflow-outflow view of the tricuspid valve and its corresponding leaflet in the orthogonal view on the right-hand side of the screen. This view is helpful again to understand the coaptation zone between the posterior and septal leaflets of the tricuspid valve, as well as understanding the relationship to each other, namely whether they are flail or prolapsing relative to one another. This lecture would not be complete without mentioning the deep transgastric view of the tricuspid valve. This image can be achieved by advancing the TEE probe deep, turning the probe to the right, and anteroflexing. And in this view, the septal leaflet is medial and the posterior leaflet is lateral in the short axis view. In the long axis view, you can see that the anterior leaflet is anterior and the posterior leaflet is in the near field. Here again is the deep transgastric view of the tricuspid valve. In this view, the posterior leaflet is lateral and the septal leaflet is medial in the short axis view of the tricuspid valve. In the long axis view, the posterior leaflet is again in the near field, and the anterior leaflet, which is poorly labeled here, is in the far field. Thank you for watching this presentation on the tricuspid valve anatomy and its interrogation. Stay humble, keep learning, and keep imaging.